recording now. Copy. And all right. So we're inviting everyone to come online. Ayan na. So they're here. Okay, so welcome everyone for our APA Livecast this May. And for today, we will be having another very special guest. Super special siya kasi ate siya ni Lou. But let me introduce her to you properly. So Dr. Carmela Caballero is actually a surgeon, a researcher, an advocate for transformative and collaborative cancer research. She is based now in Brussels, but she completed her medical degree in 2006, trained as a general surgeon, and became a diplomate of the Philippine Board of Surgery in 2013. She briefly worked in Singapore General Hospital and then moved to Brussels in 2014 for a surgical quality assurance research fellowship with the European Organization in Research and Treatment of Cancer, or EORTC. Dr. Carmela became a clinical research physician for EORTC gastrointestinal cancer and head and neck cancer group from 2016 to 2018. Currently, she works as a medical advisor for Breast International Group, or BIG. She is also coordinating the BIG Asia Collaboration and BIG North American Breast Cancer Group, NAB CG Collaboration. So everybody, please welcome Dr. Carmela Caballero.
Hello, magandang umaga po sa inyong lahat. Jirbie, thank you for the introduction. I hope you can hear me clearly. Okay, so I will start to share my screen. Welcome po sa lahat ng mga participants at saka syempre sa aking kapatid, si Lourdes. How do I stop the, wait. Ayan. Can you see, everyone can see the screen?
Yes.
Okay, yeah, okay. Kasi hindi ko kayo makikita for the moment. I don't have two screens at the moment. So, welcome po sa ating kakaibang webinar for today entitled Common Sense for Good Sense, Tips on How to Understand Essential Oil Claims and Studies. So, bago po tayo magsimula, meron lang po akong konting paalala. So, ako po ay hindi expert sa aromatherapy at hindi po ako miyembro ng isang aromatherapist group. Ako po ay, katulad ng nabanggit ni Jirbie, ako po ay isang doktor, ako po ay isang researcher. Ako po ay based dito sa Brussels. Pero yung talk po na ito, yung webinar po na ito, hindi po ito, ito po ay based sa aking personal experience as a researcher. Pero hindi po ito yung opinion ng aking, or yung pananaw or opinion, hindi po ito galing sa aking employer or sa aking mga professional associations. Siyempre, isang malaking pasasalamat kay Jirbie, founder ng Alliance of Philippine Aromatherapists, for the invitation. At siyempre, hindi ko pwedeng kalimutan, malaking pasasalamat sa aking kapatid, si Lourdes Caballero. Isa din siyang clinical aromatherapist, isang avid member ng Alliance of Philippine Aromatherapists. Siya talaga yung nag-encourage sa akin na to give this talk and to share a little bit of knowledge about understanding research. So, salamat sa kanilang dalawa. So, ano po ang ating pag-uusapan today? Meron po tayong konting introduction about sa aking background para at least maintindihan niyo po yung context ng aking talk. Tapos, magkakaroon po tayo ng mga basic questions na dapat nating pag-isipan kapag tayo po ay mayroong nababasa mga studies o mga news, blogs, Tapos pag-uusapan po natin ang yung tinatawag na levels of evidence. Paano ba natin masasabi kung yung narinig natin o nabasa natin ay sabi-sabi lang, kwento-kwento lang, or it's true lalo. Ibig sabihin, totoo talaga, di ba? And then, bibigyan ko po kayo ng konting tip kung paano ba talaga tayo maghanap ng sagot sa ating mga questions na, okay, kunyari naghahanap tayo na, oy, ano bang okay na oil para sa ganito, para sa ganito. Saan ba tayo dapat maghanap ng mga sagot? At meron tayong mga tips for reading studies or for reading news and blogs. At syempre, hindi natin dapat kalimutan tayong lahat, kahit ako ay involved sa cancer research, tapos kayo ay involved sa aroma at sa pag-aaral ng mga essential oils, pareho po tayo ay scientist, pwede po tayo magkaroon ng scientific method sa ating pag-aaral. So, yan ang ating mga topics. So, just feel free to stop me kung sakasakaling may hindi malinaw. Konting introduction lang po. Ako po ay isang general surgeon. Nag-aral po ako sa Pilipinas. Pero since 2014, dito na po ako nakatira sa Belgium. Ako po ay nagtatrabaho para sa Breast International Group or BIG. And ito po ay isang not-for-profit international research group focused on breast cancer. Ako po din po ay miyembro ng European Society of Surgical Oncology Young Surgeons Group at ako din po ay nagbabahagi ng aking kaalaman tungkol sa science sa mga high school students sa Pilipinas as a mentor of SIDHI Philippines. So, ito po ang first topic natin. Kapag meron po tayong nabasa na mga tinatawag na news, scientific news, o kaya mga studies na tinatawag, o kaya mga blogs, or ano po ba yung mga dapat nating itanong? Okay? Sandali. I don't know how to hide this. Okay. Anyway. So, basically, kapag nagbabasa po tayo ng kahit anong news, ang kailangan po natin ay yung mga basic questions na who, what, where, when, why, and how. Ibig sabihin, hindi po tayo pwedeng agad maniwala na basta nabasa po natin na ganito ay tanggapin natin, uy, ito ang miracle cure. Pag nagbabasa po tayo, ito po yung ilan sa mga guide questions na dapat po nating itanong para maisip po natin, yung tinatawag natin na critical thinking. Okay, kapag nagbabasa po tayo ng mga studies. First of all, dito po, sana makita nyo dito. Kapag nagbasa tayo, pwede nating alamin sino ba yung sponsor ng study na ito o sino ba yung nagsumusuporta sa study na to. Kasi katulad sa amin, minsan mga pharmaceutical company ang naggawa ng mga research, di ba? So, sino ba ang makikinabang sa produkto na ito, di ba? So, meron din po tayong mga questions na ano ba yung pinapakita nila na positive at saka negative results? Kasi minsan, kapag nagbabasa tayo ng balita, ang sinasabi lang yung positive result. Pero minsan, hindi sinasabi yung mga side effects. So, dapat papag-isipan po natin ito. Tapos, dapat din po natin alamin kung ano ba ito? Study nga ba ito o merong produkto na ibinibenta sa akin? Yun. Importante din pong alamin saan nabasa ang balita at mamaya ipapakita ko po sa inyo kung ano ba yung mga iba-ibang sources ng mga balita or mga studies. Ibig sabihin, ito ba yung balita na ito kinuwento lang dahil sa akin, dahil sinabi sa akin ng kaibigan ko, o ito ay na-publish talaga sa isang parang journal na tinatawag, o ito ba binalita sa Philippine Daily Inquirer, o ito ba ay nabasa ko talaga sa isang libro o sa isang journal. Tapos, dapat din po natin itanong kailan ginawa ang pagsusuri. Kasi minsan di natin napapansin, uy, yung binabasa pala natin 10 years ago na o kaya 20 years ago na. Ibig sabihin, baka hindi na updated yung information. So, minsan, hindi agad natin napapag-isipan pero baka hindi na pala updated yung ating information. Finally, meron din po tayong two important questions. Yung tinatawag na why and how. Bakit ginawa yung pagsusuri nito? Ano yung problema na tinatry nilang resolve at bakit ito mahalaga? Most importantly, para po sa ating mga scientists, paano ginawa yung pagsusuri? Ibig sabihin, sumunod ba sila dun sa scientific method? So, mamaya ipapakita ko po sa inyo itong scientific method. So, kapag po tayo nagbabasa ng mga studies, siguro po familiar din po kayo dun sa tinatawag na yung quotation, famous quotation na sinasabi na don't judge a book by its cover, no? Kasi minsan meron po tayong mga tinatawag na yung tinatawag na prejudgment or preconceptions, yung tinatawag natin na bias. Ibig sabihin, hindi pa man natin nabasa yung balita o hindi pa man natin nabasa yung study, tayo convinced na tayo na, ito ang gagawin ko. Ito ang opinion ko. Pero hindi pa po natin nababasa yung balita o yung news. So, kapag po tayo ay nagbabasa ng mga studies, we have to keep an open mind at meron po tayong mga guide questions para sa ating tinatawag na critical thinking. So, bago po natin, kunyari sa mga essential oil, bago natin sabihin, uy, sabi ng balita na itong essential oil na lavender, uy, okay daw to para sa balat. Okay? Bago po natin tanggapin yung balita na ito, dapat nating magkaroon tayo ng tinatawag na critical thinking sa ating nababasa. Check your biases or your preconceptions. Maigi po nating titingnan ano ba yung evidence that is presented to us. Ito ba ay, yun nga tinatawag na kwento-kwento lang o talagang pinag-aralan? How reliable is the evidence? Does it come from a trusted source? At dapat din po tayong maging sensitive, uy, ano yung mga bagay na hindi nila sinasabi sa atin, like side effects. Okay? Usually, kapag may mga studies po na naging hindi positive, parang hindi positibo yung resulta, minsan hindi nila sinasabi yung negative results. At ito din po yun, related sa what is the other side of the story. Okay, so siguro ito po yung isang first tip na pwede ko pong ibigay sa inyo. Kapag tayo po ay nagbabasa ng yung mga tinatawag na mga news or studies, meron po tayo mga tinatawag na levels of evidence. Okay? Ibig sabihin, hindi po lahat ng nababasa natin na studies ay pare-pareho at hindi po lahat sila ay kumbaga yung tinatawag na matibay na patunay or matibay na study, right? So, dito sa pyramid po na ito, dito sa triangle na ito, makikita po natin ang isang simple representation. Paano natin malalaman kung gaano katibay yung evidence na binibigay sa atin. Yung pag sinasabi po natin evidence, ito po yung mga sinasabi nating mga news, mga vlogs. So makikita po natin dito, sa pinakamababang level or pinaka-lowest level of the pyramid, ito po yung tinatawag natin na mga kwento-kwento o yung mga tinatawag na testimonials, anecdotes, o kumbaga yung mga traditions or yung mga nasabi ng sino. Traditions like, uy, ito sinabi sa akin ng lola ko, ito daw ang gagawin. Okay? So, okay din yun kasi matagal na nilang ginagawa. Pero, hindi natin sigurado, okay, paano talaga naimbestigahan yung effect, di ba? Lalo na kapag mga testimonials or kwento-kwento, uy, sinabi sa akin ng kaibigan ko ganito, uy, sinabi ng celebrity na ito ganito. So ito po ay tinatawag na lowest level of evidence. Hindi ibig sabihin na hindi totoo, pero ang ibig lang po sabihin na kumbaga, kumbaga tayo ay haharap sa korte, ito yung pinaka weakest evidence basically. Susunod po dito yung mga tinatawag na mga blogs o mga YouTube video, expert opinion. So kahit ako bilang isang doktor, kapag ako lang yung doktor na nagsabi sa inyo na ito, okay po ito, as a doctor, as one doctor, ito po ay isang opinion lamang, expert opinion. So, hindi ibig sabihin na hindi totoo yung sinasabi ko, pero makikita po natin dito na ito ay hindi pa rin gano'n kataas yung kanyang level of evidence. Higher level of evidence, ito po yung mga tinatawag na yung mga studies na po talaga. Talagang maraming mga data na po, pero ibig sabihin yung mga smaller data sets, weaker evidence compared to larger data sets. So, ibig sabihin, gumawa po tayo ng study. Tapos, yung study po natin, siguro, let's say, 20 people only. Weaker evidence po ito compared sa isang study na ang pinag-aralan nila ay, let's say, 3,000 people. Okay? O ginawa sa isang environment na 3,000 people ang involved. Okay? So, 20 people versus 3,000 people, ibig sabihin, mas marami kayong data na mapag-uusapan, tapos yung chance na yung tinatawag natin na risk of bias, ibig sabihin yung parang ano lang, parang by chance lang na naging positibo yung result, mas lumiliit habang lumalaki yung data set or yung number of people na pinag-aaralan. So, kunyari, nag-survey. Kunyari ngayon, di ba, dahil elections, nagsusurvey po tayo. Kapag meron po tayong survey na ginawa, kapag meron po tayong survey na ginawa sa 10 tao, yung magiging result po ng survey na ito ay mataas yung bias. Kasi ibig sabihin, 10 lang yung tinanong. Sorry. It's okay. It's okay. Sa, kapag mas maliit po yung survey, o kunyari po, 10 tao lang yung tinanong, it has a higher chance of giving us a higher risk of bias. Whereas, kung ang tinanong po sa isang survey ay, let's say, 10,000 people, mas lumiliit po yung chance na magkakaroon ng bias doon sa resulta ng survey. So, ibig sabihin, kunyari, kasi pag sinabing nagkaroon ng survey for 10 people, kapag ang kalahati ng tao ay tinanong ay nagsabi ng yes, 50% na agad yon. Pareho din po pagka nag-survey sa, let's say, 10,000 people, tapos ang sinabi ng kalahati ay yes, 50% din po yun. Pero yung sa isang side, it's 5,000 people. Pero pag ni-report yan, parehong sasabihin, 50% of the people said yes. Pero yung isang survey, 5 tao lang pala. Yung isang survey, 5,000 people pala. So, dapat po pinag-iisipan po natin maigi yun. Next po ay yung tinatawag na experimental studies with protocols. So ito po yung mga studies na tinatawag natin na talaga pong meron na pong nakaset na talaga na mga protocols. Tapos ito po yung mga tinatawag natin ng randomized clinical trials. Ibig sabihin, kunyari, yung pasyente, hindi niya alam kung ano yung binigay sa kanya. Binibigyan lang po sila ng tinatawag na placebo, o pareho po yung parang yung pasyente at yung doktor, hindi nila alam kung ano yung medication na binibigay sa kanila. Pero pareho silang i-monitor at the same time, pareho po yung paraan ng pagbibigay ng gamot, pareho po yung paraan ng pagsusubaybay. So kapag yung meron tinatawag tayo na randomized clinical trial, ibig sabihin, bumababa yung level ng bias. Ibig sabihin, hindi natin, until the end of the study, doon lang po natin malalaman ano yung resulta nung study na ginawa. So, yun po yung tinatawag na randomized clinical trial. Tapos, kapag marami na po mga clinical trial na pinag-aralan, pinagsama-sama na po yung mga malalaking clinical trial, ito na po yung tinatawag na meta-analysis. At ito na po yung tinatawag natin na highest level of evidence kasi yung mga malalaking trials or mga malalaking studies, pinagsama-sama na po nila yung result. So, bago po ako magpatuloy, gusto ko lang itanong kung may mga questions or may mga hindi po naintindihan.
Hello, yung question ko, yung dun sa paghalimbawa, di ba yung observational studies na cell or animal experiments, yun yung in vitro, tama ba? Tapos mas higher ba yung level of evidence kung live subjects? Dun ba yun saan yun papasok na layer?
Oo, okay. So, yung mga animal studies, ito ay mga importante sila kasi ito talaga yung simula na naiintindihan ng mga biologists at scientists paano yung mga chemicals, paano yung mga gamot, how they affect cells, okay? How they affect small organisms. Sa mamaya ipapakita ko po sa inyo in the context of developing drugs or medicines, yung mga traditional medicines, parati ito nagsisimula yung mga tinatawag ng cell studies, mga animal studies, at pinipili nila yung mga animals or subjects na close to the functioning, yung parang yung cells or yung animals parang pareho, almost pareho dun sa magiging reaction ng human body. Okay? So, it's a foundation to understand how chemicals work, how studies work, how drugs work. Okay? Pero, hindi lahat ng mga studies na, let's say, naging positive ang result for animal studies will immediately translate with the same results for persons, for people, for human subjects. Kasi kahit na similar yung functioning ng mga cells, let's say ng rats at saka ng human cells, kahit na may similarity sila, mas complicated yung functioning ng human body. Kasi yung mga animal studies, usually, minsan ang ginagawa is they inject the chemicals or they implant the chemicals or they minsan they allow a small amount of the chemical to be ingested by the animal. Pero for human beings, syempre iba yung way ng delivering medications, chemicals. Minsan they inject through the veins, minsan we have to take it orally, tapos it goes through our body. It is metabolized by the liver, it is metabolized by our body systems. So, maraming iba-ibang processes, okay? Most of all, syempre kapag sa mga animal studies, very well controlled ito. Ibig sabihin, kasi syempre they're dealing with very precise amounts of, let's say, the chemical, and then they can inject it into the petri dish and to the cell. So very precise. Sa mga clinical trials, when you start giving the testing chemicals or drugs to people, syempre, yung person po niyang sabihin, ay, ayoko pong i-take yung medicine today, nakalimutan ko po. Okay. Ay, naku, 2 pills pala yung dapat inumin. Naku, isa lang po yung pill na nainom ko. Nasa clinical trial na to, ah. So, kahit minsan meron ka ng very clear instructions on how to administer the drug or the chemical, meron tayong tinatawag na human factor. So, that's why hindi lahat ng mga positive na results for animal studies, hindi lahat sila nagiging positive ang result dun sa mga bigger studies with very strict experimental protocols. Tapos, syempre, hindi rin pareho yung mga side effects na makikita natin when it comes dun sa mga smaller animals or minsan sa mga cell studies, syempre hindi mo makikita yung side effects. Pero when it comes to people, syempre iba-iba ang effect ng iba-ibang bodies and ages and age groups to certain chemicals and to certain people. So, yun. Did I answer your question, Lourdes?
Ibig sabihin, pag nakakita kami ng study na ito in vitro, ito in vivos, magka-same level ba sila? Or mas mataas si in vivo? Kasi tinatry mo na siya sa humans.
Oo. Siyempre, mas mataas na level kasi bago nila i-try sa humans, anything na bago nila i-try sa humans, kailangan meron na silang certain level of confidence na it 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 can work. So, ibig sabihin, meron na silang tinatawag na basic research, basic foundation ng kanilang knowledge na nagsimula dun sa mga animal studies. Pag meron na silang mga nakitang initial results, titignan nila, okay, ito bang mga resulta na ito, pwede na nating i-test sa human subjects. Then they will try first to a few subjects, very few subjects muna kasi titignan muna nila kung paano magre-react yung isang person. Okay? Tapos kapag nakita nila yung result in a small group of people, ayun na, lalakihan nila ngayon ulit yung panibagong group of persons. Okay, they will test. I have a slide actually to show this later on. Pero um, yun yung tinatawag natin na paraanong pag-aaral ng mga chemicals. So, it doesn't mean na um, mas anytime na magkaroon ka ng mga human studies, it will always be stronger compared to animal studies. Kasi syempre, ito na talaga, tinitest mo na talaga sa human body, yung chemical at yung mga drugs.
Kasi kaya ako natanong kasi, for example, sa amin, wala namang sa aming doktor. Tapos nun, pero pag mag-study ka kasi ng aromatherapy certification, meron siyang requirement na research sa dulo. Ngayon, syempre, gagawa ka ng blend, for example. Tapos nun, papatry mo sa ilang subjects na kakilala mo. 'Di ba? So, parang isip ko, kung hindi ka, mawawala ka namang PhD or medical degree, pero nag-design ka ng, sige, meron akong massage blend. Gusto ko malaman kung ito ay makaka-relieve or makakabawas ng back pain, lower back pain, for example. Tapos gumawa ako ng design na, sige, bibigyan ko tong 5 tao na to ng, tapos ninote mo na yung, parang gumawa ka ng simpleng design experiment. Ibig bang sabihin, nung nandun na ako sa experimental studies with protocols, kahit na, ordinaryo lang ako na nag-aaral pa, yung taon na degree, doon ba yung papasok?
Yung binigay mong experiment, it can fall under this, yung color green, na observational studies, small data sets. So, automatically, kapag nag-isip ka na ng sort of experiment, andito ka na ito na, tumataas na yung level of evidence mo kasi nag-a-apply ka na ng what you call a scientific method to understand ano yung effect ng iyong ginawang blend. Okay? Nandito ka na. Kasi kapag tinest mo lang for a few, balik muna tayo dito. Kapag tinest mo na for a few studies at nag-isip ka na, meron kang study design na tinatawag or meron kang maliit na research project, titingnan mo, how does this blend work? Tapos inisip mo, okay, ite-test ko sa iba-ibang mga kaibigan ko, isusulat mo, anong nangyayari sa kanito, sa ganito. Yun ay tinatawag na natin isang observational study. It might not yet be an experimental study kasi yung experimental study, ang ibig sabihin nito, meron kang master blend A, master blend B. Tapos, tinitingnan mo na, kino-compare mo, ito bang si master blend A? Kapag tinest mo dito kay kapatid number 1, at itong master blend B, tinest mo din to another subject, ano yung effect? So, yun na nagko-compare ka na. Itong observational study, meron ka isang master blend, sinusubukan mo muna sa mga tao, tapos nililista mo lang ano yung naging side effect, ano yung kanilang naging epekto sa kanila. So tapos meron ka lang 5 or 10 friends na tinanong, ito yon. Pero makikita natin, maganda na yung, nandito ka na sa color green, tumataas na yung level of evidence mo. Okay? So, hindi ka na nagre-rely sa nakita mo sa YouTube, tapos tinest mo sa sarili mo. Nandito ka na, meron ka ng binasa, uy, ito potentially okay to. Binasa mo kung ano yung mga potential effects. Gumawa ka ng blend, nilista mo. Tapos, ito ay tinatry mo na dun sa mga kaibigan mo, pero nililista mo yung epekto. That can be considered an observational study already, potentially. Okay. So para magkaroon tayo ng more background, i-compare natin kasi ito kahit I think ma-encounter nyo rin ito as a clinical aromatherapist, yung mga iba-ibang kinds ng mga studies, no? At least these are studies that are done for drug development, okay? So lilinawin ko na this is something about developing drugs or typical medicines. It is very possible na you don't find it exactly in the same way sa context ng essential oils. However, dito lang, ipinapakita lang natin dito yung kung paano yung stages ng development ng mga iba-ibang kinds of chemicals or mga drugs. Okay. In the context of drugs, of let's say cancer treatments, mahaba yung pagsusuri na ginagawa kasi syempre ang mga drugs, it can have life-threatening side effects. Pwede ka talagang magkaroon ng mga tinatawag na mga fatal side effects, yung talagang syempre nakakamatay, di ba? Or it can cause unwanted effects, let's say for a pregnant woman, or let's say for an unborn child. So, ibig sabihin, talaga yung pagsusuri na ginagawa, it passes through several stages of investigation. For essential oils and chemicals, it is very possible na hindi ito natetest to, let's say, 5,000 people. Kasi ako, in my line of work, of course, nandito na kami sa part na ito, yung phase 3 at phase 2 and phase 3, sometimes phase 4. So, yung mga studies na ginagawa namin, it usually involves at the minimum 1,000 people to around 5,000 people na nagkakaroon na kami ng mga experimental studies. In the context of many other chemicals or even food products, sometimes nandito sila sa part na ito, yung parang earlier stages of clinical trials, even for, let's say, cosmetics. Even for cosmetics, minsan nandito lang sila sa mga clinical trials that investigate maybe 20 people, 50 people. It doesn't mean that these are not correct ways of investigating. It's just that it's a smaller group of subjects. So, yung tinatawag natin na mga preclinical or animal studies, ito po yun, yung mga tinatawag natin na preclinical studies. So, talagang ang pinag-aaralan, mga cells of either, usually cells of animals. Okay? Minsan, cells of human beings, pero like one cell only or a few cells. Pwedeng ganon. Once you really test it sa human beings, pero na talagang tinatawag na yung mga first in human studies, phase 0 studies. So, ito, pipiliin yung dose, tapos mag-move sila sa a little bit of a bigger study, phase 1 clinical trials, na aalamin nila, okay, ano yung pinakamataas na level ng dose na magkakaroon ng good effect or na magiging effective to treat a disease. Pero syempre pinag-aaralan na ano yung side effect ng very high dose, right? So hahanapin nila ngayon yung pinaka-optimum na dose to deliver good effect with minimal side effects. So, mula sa phase 1, mag-move na ito sa kapag nahanap na nila yung optimal dose of the treatment, they will move to a phase 2 clinical trial. Meron ka ng specific dose of the treatment. Tapos titingnan nila ngayon how it affects a bigger group of people. Tapos itong tinatawag natin na mga phase 3 clinical trials, ito na talaga yung gagawa na sila ng yung mga tinatawag na randomized clinical trials na i-compare na nila ngayon yung itong bagong treatment na ito, i-compare nila sa mga dating treatments or yung mga standard treatments. Titingnan nila ngayon yung side effect. Titingnan nila ngayon, ipa-follow nila ngayon yung mga pasyente for 5 to 10 years. Tapos titingnan nila ano yung short-term at long-term side effects. After nito, kasi ito lahat to mga clinical trials, controlled clinical trials, kapag nag-positive yung trial, na-approve ng FDA or ng dito sa Europe, EMA, European Medical Agency, mag-move na ito yung sinatawag na real-world assessment. So ito na, wala na to sa mga clinical trials. Titingnan nila ngayon, paano yung mga gamot, what's the effect kapag it's taken outside of a clinical trial. So, magkakaroon na sila ngayon ng mga tinatawag na post-marketing investigation. Ano yung nangyayari sa mga tao kapag inunom ng nila ito on a regular basis outside of a clinical trial. Meron ng mga gamot na pumasa hanggang phase 3, pero pagdating sa phase 4, outside of clinical trials, nakita nila, ay, ang daming side effects kapag hindi controlled environment. So, napupull out ang mga drugs na ito. So, yun. Meron kayong tanong or merong clarifications?
Siguro parang dahil hindi naman classified as gamot si essential oil, parang magandang guide sa amin yung phases. Siguro, hanggang saan lang ba tayo dito, Jirbie? Parang ano lang tayo, hindi naman kami sa preclinical kasi hindi naman namin siya sa cells.
Potentially, baka pwedeng, siguro ako, I can imagine, baka pwede pa kayo umabot dito sa mga phase 2. Pero, meron akong mga nakikitang studies na iba, yung minsan yung mga, the way they design at the trial, it can be an experimental trial. Pero may mga nakita ko recently about yung effects ng mga specific essential oils for patients undergoing surgery. Tapos, they test it on a long-term basis or a longer term. So, observational study dito. Potentially, hindi ito man mako-consider na phase 3 na talagang yung tinatawag na randomized clinical trial. But, minsan yung mga studies na ito, parang either the patient or the doctor or the nurse is blinded. So it's some kind of an experiment as well, and it can be a very strong level of evidence. Yeah.
Siguro
So,
siguro yung takeaway ko kasi dahil kumbaga nagpa-practice kami ng aromatherapy or mga nag-aaral, sometimes masyado kaming focus dun sa paggawa ng blend, pero hindi kami sobrang ganun ka diligent, siguro hindi kami lahat. Bawa ako, I can speak for myself, sometimes hindi ko na nalilista lahat ng mga naging effect kay subject 1, kay subject 2, 'di ba? So parang yung part na it could have been a more learning opportunity for me to know across a different kind of backgrounds or ng mga subjects, ano yung naging para makita ko yung maximum tolerated dose or effect of a specific dose of the drug for halimbawa a pregnant woman or a child. Minsan nami-miss out ko na yun kasi sobrang focus ko na dun sa mabango na ba to or okay na ba to, ganyan. So siguro yun yung reminder na kung gusto mong to do this with a critical mind, na don't forget the taking down notes of,
exactly.
yan.
So, yun, mamaya papakita ko yun, yung in a way to empower our colleagues and our friends in the clinical aromatherapy field. So, syempre magkaiba talaga. Kaya ko din pinakita to kasi although ang message ko dito actually is although magkaiba yung way of drug development as compared to let's say investigating essential oils, it doesn't mean that it is less scientific. Okay? It doesn't mean that it is a weaker form of science. It's not that. Um, as mentioned, for drugs, it's very important to really be very what we call stringent or very strict sa rules of investigating drugs kasi it can have fatal side effects. For essential oils, it can have potentially dangerous side effects pero I don't think that they will really be fatal unless talagang ininom mo yung kung ano mang dangerous essential oil. But it still gives the opportunity to a lot of people to have a very precise way of documenting ano yung effects nung mga oils na ginagamit, and you can see for yourself, oh, ito ba, is this a good essential oil? Tapos nakita ko din sa mga ibang vlogs na at saka yung mga ibang documents that that I read about essential oils, there is a very precise way of preparing yung mga dilutions and everything. There's a very precise way to do it. So it means na ganun din for drug preparation, it has to be very precise para magkaroon ng maibigay yung desired effect, 'di ba? So, okay. So ito yung ating message na for any kind of chemical, meron tayong yung merong stages kung paano natin masusuri kung paano yung effect talaga ng particular chemical or particular drug sa isang tao or sa isang community. Okay? So yung next part natin dito ay okay. Where to look for answers. Okay. So, katulad nito marami tayong mga common questions 'no, para sa mga, ating mga kasama na gumagawa ng mga blend. So, nakita ko yung mga usual na mga questions na, "Uy, ano po ba ang mga master blend for rashes?" Okay. "Ano po ba ang mga master blend for immune support?" Okay, master blend for babies at mga master blend for cancer patients. Yan, nakita ko yung mga questions na ganito 'no. Tapos siyempre para sa kahit sinong individual, kahit sinong tao, gusto natin yung makakatipid tayo, yung madaling madaling gawin, madaling i-apply sa katawan, at siyempre gusto natin mabilis ang epekto, 'di ba? Pero siguro ang masasabi ko lang dito, is that kapag kumukuha tayo ng information about these types of solutions for our problems, or solutions for common yung mga kung ano yung mga specific oils for whatever kind of problem, beware. If it sounds too good to be true, it usually is. Ibig sabihin, it's too good to be true. So, ibig sabihin, baka hindi talaga nga totoo, di ba? Beware kapag sinasabi ng mga balita or mga news na, oh, this is a miracle cure. O kaya, uy, this is a complete scientific breakthrough. Or this is 100% safe. Kasi kahit po dun sa mga pinakita ko sa inyo ng mga studies a while ago, phase 1 to phase 4, no drug is 100% safe. Lahat po yan ay may potential side effects. So, beware po kapag nakita nyo ang heading ng isang news or isang blog ay, oh, I found the miracle cure for rashes. This is the master blend for that will give you a miracle cure and this is 100% safe. Ito po mga ano yan, dapat ano yan, red flag na po yan para sa atin. So, kapag tayo po ay naghahanap ng information, we always have to check ano ang ating source of information. Kahit man po ako po ay isang scientist, ako po ay doktor, kapag ako po ay naghahanap na, ano kaya maganda parang moisturizer, let's say. Ano bang una ko gagawin? Punta ako sa Google, punta ako sa mga vlogs, punta ako sa YouTube, 'di ba? Titingin ako, ano bang sinasabi ng mga tao? Pero ang dapat nating pag-isipan dito, yung ating levels of evidence. How strong is the evidence being presented to you? So anytime na maghahanap ka ng, it's not, hindi natin pinagbabawal tumingin sa Google o sa YouTube, pero dapat po nating isipin, how strong is the evidence being presented to you? Okay? Dito po, nagbigay ako ng mga examples sa mga, nag-research ako ng konti kung ano ang ating mga in the context of aromatherapy and essential oils. Napansin ko po na dito sa mga specific links na ito, which I'm sure you're all familiar with, like for example, in this particular organization, tizerantinstitute.org, nakita ko na meron silang mga very comprehensive background ng mga essential oils. Okay? Meron silang mga, I think the way they presented the information about specific essential oils is, I would say, balanced, neutral, ibig sabihin, pinapakita yung mga iba-ibang studies that, support, this is the use of this particular essential oil. Tapos, ito naman, I think, if I'm not mistaken, ito yung particular link na ito, they provide the specific dilutions of specific essential oils, kung paano yung safe and precise dilution for specific oils. So it's really a good guide for those who are trying to create blends. And in a general sense, kapag ako, as a doctor, as a scientist, I usually go to this particular website called Medscape kasi they have specific sections where they are able to present in a very understandable way yung mga studies, yung mga news, yung mga scientific information. They also have specific guidelines about specific treatments. So maraming iba-ibang topics and there's a specific section on dermatology, for example. So it's evidence-based, but it's presented in a very somehow lay language or understandable way. Pero kapag po kayo ay naghahanap ng research or ng mga papers and mga journal para sa inyong mga pag-aaral, understanding more information about the scientific information about essential oils or your aromatherapy, ito po yung mga ma-recommend natin na mga potential sources of information. Google Scholar, PubMed. Okay, papakita ko po sa inyo yung difference kapag tayo ay nagkumanap ng mga information from these different sources, no? So, katulad po ng nasabi ko sa inyo, kapag ang first instinct ng kahit sino po ay pag may information na gusto kang malaman, i-Google nga natin ito. So, katulad nito, while preparing for this talk, I tried to check, what can be the specific essential oils? So I'm particularly interested in lavender. What can be an essential oil that we can be used for cancer, whatever kind of cancer treatment. So titignan natin, syempre ang simula, mag-Google tayo. Kasi itong Google, kasi madali, accessible to everyone. So, okay. Siguro maybe, can anyone give me a guess kung ilan ang magiging hits kapag in-enter natin ito? yung term na ito sa Google?
5,000?
Oh, thousands.
Okay? May iba pa
Okay.
tayong
Halo-halo.
guess. Halo-halo, di ba?
100,000.
100,000. Uy, magandang guess yan.
Wow.
So, ito po, ang ating, ito po,
Oh,
hindi tayo
wow.
100,000, 5
Million.
million.
Kakaloka.
Ooh,
5 million
million.
results. 5 million. Paano ka naman magbabasa ng 5 million? Tapos syempre, pansinin po natin, kapag ano po yung, kapag nag-type ka sa Google, you just use Google, ano yung mga lalabas? Karamihan po dito, okay, cancer.net, okay? Potentially it's a blog or potentially it's a platform about different sources of information about cancer. Everydayhealth.com. Voice. So, maraming, ang lalabas na mga karamihan, depende sa ilalagay mong term, minsan ang mga lalabas ay mga blog sites, mga vlog sites, news, or, halo-halo information. Oo. Halo-halo. So, ikaw, kahit ako po, no? I mean, I have to sort it out kung ano yung, saan ba ako titingin ng information. Anong magiging difference if we say, sige, sa halip ng Google, ang gagamitin ko ay Google Scholar. Google Scholar. Guess po tayo kung ilan ang pwede nating magiging hits kapag we use the same term. Can anybody guess
Thousands pa rin ako.
Thousands pa.
1,000 na lang ako.
8,000
10,000
pa.
ako.
Ayun. Magaling to sa summer. Magaling to
Summer, ha? May talent, ha? May talent.
Oo. The price is right.
The prices. So,
Close.
8,000 results. Pero, mapapansin mo dito, ang mapapansin natin dito, you can already see na ito hindi na mga blogs ang tinitingnan niya. It gathers all scientific information from many different scientific journals, scientific databases from the whole internet. So, ini-eliminate nila lahat ng mga blog sites, let's say. So, mapapansin mo dito, it might be, so ito, Clinical Journal of Oncology Nursing, published in 2017. Ito, journals from sage.com. So, makikita mo na yung difference, sinusort out na niya kung saan niya kinukuha yung information. So, for Google Scholar, so for anyone doing research, it might be a good starting point kasi it gathers all scientific evidence or scientific information from scientific databases all over the internet. Okay? So,
pero pag yun ganyan, dapat bang i-check namin yung since 2018? Kasi
okay,
parang,
so,
ano ba dapat?
There's, minsan, syempre, the more updated the information, it might be better to get a more updated information. Pero syempre, for example, in my specific field in cancer treatments, we also try to go like maybe 10 years, 15 years ago because minsan yung mga alam namin na mga na-publish na mga original clinical trials from before, we try to see minsan ano na yung naging long-term effect ng mga specific. So, I wouldn't limit you necessarily just to look for information sa 5 years from now kasi minsan merong mga important information na makukuha nyo from studies from 10 years ago, 15 years ago, in the sense na mako-compare nyo ano yung mga nakita nilang side effects before, tapos after several years, how has it evolved? So, pwede yung maging isang basis yun. Pero whenever you're writing, let's say, report, mas maganda na meron kang a few sources from, let's say, 10, 15 years ago, pero dapat importante na meron kayong updated information, I would say 5 years ago. In the context of drug development, napakabilis ng drug development. So, yung alam ko 5 years ago, it's very different from what is happening now. So, this is in the context of drug development. It might be different in the context of, let's say, essential oils. So, pero ngayon, I would say that, so I wouldn't necessarily limit you to just looking at like very recent information. It might also be worth it to have a few studies to read from 10 years, 15 years ago, and check how it is being, how the study has evolved now. So finally, kapag tayo ay pumunta sa more specific source of information, meron pa tayong natitibang PubMed. So yung PubMed, it's a bit more selected yung kanilang sources of scientific evidence. 38 results na po tayo. So biruin mo from 5 million to 8,000 to 38 results. And why? Kasi syempre itong PubMed, it's a little bit more limited. Mas marami itong mga scientific databases that they gather evidence from, let's say, mostly English, mostly from the US. Or medyo mas limited yung kanilang sources of information or sources of studies. So pero ito, makikita mo 38 results. Pwede mo nang mabasa yan. Tapos ito, pwede mo siyang i-filter, mas madali mo siyang i-filter from how many years yung time frame that you want to check, yung type of study that you want to read. Is it a clinical trial? Is it a book? Is it a randomized clinical trial? Mas madali mo ngayon siyang i-filter. So for several people who are trying to understand or trying to do some readings, marami tayong sources of information, but the message of this is that you can try to filter out where you will get the information which has a higher level of evidence. Okay, if you go to Google, you will find all kinds of information, and you yourself, you need to sort out very well ano yung information that will give you a good level of evidence or a high level of evidence. As you narrow down from using specific search engines, or not search engines, but specific databases like Google Scholar and PubMed, mas nagiging narrow yung types of studies that you will have. At I think it gives you a bit more reassurance that you will probably get a higher a study which probably has a higher level of evidence. Yun ang ating message. Okay, so give me a moment. Tips for reading studies. Basically, maraming ways to perform critical thinking when you read studies. Pero basically, I just want to bring you back to our original, what we said earlier. Kahit ano to, it applies to any kind of study, news, vlog, YouTube, and everything. Ito pong who, what, why, where, when, and how. It will be the basic guide for us to understand ano yung sinasabi ng journal na ito. Okay? So, pag nagbabasa tayo, kailangan nating basahin, ano ba talaga yung sinasabi ng journal na ito? Sino ang naggawa ng study, sino nag-conduct ng study, what are the positive and negative results, kailan ginawa yung study, how was it done? So how was it done? Meron na kayong basic guide dun sa types of studies that are possible from phase 0 to phase 4. So yon, medyo mas may guidance na kayo at this point. So ito siguro I would just give you, I have here 3 examples and we can look together kung ano yung type of information na makikita natin, no, in terms of strength of evidence. So wait. So tingnan natin ito. Ito sort of interactive exercise. Tingnan natin. So I use the same term, essential oil lavender cancer treatment. So ito, when we go to this particular site, kita natin 3 essential oils that may help fight cancer. So ang mako-comment natin dito, siguro I can ask you, for example, ano yung mga napapansin nyo na mga so ito, it speaks about, okay, what are the potential essential oils that might be beneficial for some cancer patients.
Are we supposed to see the screen?
Ay,
Kasi makikita
tayo
natin
na.
yung PowerPoint.
Talaga? Oh, sige, wait lang. Wait. Ito.
Yeah, there you go. We can see it now.
Okay, so pumunta ako dun sa isang blog. It looks to me like a blog site of different health issues. So ito, pag nagbabasa ako nitong particular blog na to, ang mapapansin ko, first of all, so it gives information about different essential oils, pero mapapansin ko, walang masyadong scientific sources, I would say. Kunyari ito, a study was published in 2009 that evaluated, pero mukhang hindi niya na-quote kung nasaan ang study. Kasi ito na yung end ng study eh. Tapos nakalagay dito sa at the end, this text is sourced from zliving.com. So it's another website potentially. So yun yung first comment ko dito, na it's a very brief description of the different essential oils. It mentions about old studies, pero hindi niya, tapos ito, it says, okay, a study was published in 2009 about lemongrass essential oil against 12 human cancer cell lines, pero hindi niya minention yung study. So for me, ano na yun? For me, it's a red flag. Kasi, syempre, whenever you quote or you mention things like this, it's important to provide the reader or to provide people the information, nasan yung source ng information. So the reader himself or herself can read and check ano yung sinasabi mong study, diba? So, parang if you look at the question here, the title, 3 essential oils that might help fight cancer, the title might be a bit misleading kasi essential oils that might help fight cancer. Pero pag binasa mo dito yung actual text, it doesn't give you the strong level of evidence that will actually connect to that first question, what might help fight cancer, right? So, hindi matibay yung evidence na binibigay sa atin about these about the specific oils that actually might help fight cancer. Kasi hindi niya binigay yung source eh. So hindi natin ma-judge maigi ito bang sinasabi ng article na ito is really true or not? Kasi kinote lang niya pero hindi niya binigay nasaan ang source of information. So, okay. May question po ba kayo dito?
Well, ang daling mabudol ng mga website.
Ah,
Minsan kasi parang, ano to, di ba, parang ano ba yung confirmation bias ba yung tawag doon? Pag may iniisip ka, you'll end up finding something that, syempre, ginugol mo sa, ano, di ba, parang positive effect, lavender, skin. Hindi malamang yung makikita mo, parang, oh my God, meron nga. Ganyan.
oo. So,
Not knowing very little about cancer, minsan basta nakita mo na may sinite siyang study, minsan hindi mo na maiisip na ano ba yung eksaktong source nga. So,
oo. At saka ito, kasi syempre pag naisip mo, oh, three essential oils that might help fight cancer. Pag hindi mo talaga binasa, uy, frankincense daw, lavender, at saka lemongrass. Okay. Pag hindi mo binasa, tapos hindi mo pa binasa yung nakalagay dito kasi nakalagay dito, studies have been done. Pero pag binasa mo, okay, these have been done on mice and cell lines. So, as I mentioned, these are basically, yung ganon kapag sinabing cell lines and done in mice, that's basic science. That is the foundation for developing further trials. Pero hindi pa yun yung mga tinatawag natin na confirmatory studies to really say na, oh, itong specific chemical or drug na ito can actually fight cancer. Okay? So pag hindi mo, wala kang ganung background information, makikita mo lang, uy, frankincense, lavender, at lemongrass can help fight cancer. Okay. Diba? So, yun yung dapat lang natin pag-isipan. Okay? So, if we pause muna ito, tapos, wait. Then, if we go back, give me a moment. So, ayan. I will go to the other. Okay, so, nasa na ako? Ayan. I will share na. Teka. Ito naman. This is another website. So it's from, this one is everydayhealth.com. It's still a blog site, I think. It's from 2019. And ginugol ko din yun about essential oils for cancer. It's the same thing. So ito, ito ang kanyang title, All You Need to Know About Essential Oils and Cancer. Okay. So, itong particular blog na ito, so may binigay siyang listing about specific essential oils that might be popular in supporting cancer care. So ito, mas maganda yung presentation niya kasi, ayan, binigyan niya na ng mga links, binibigyan kanya ng mga links, where you, pag you hover in this particular one, then you will be able to see the specific journal. Tapos ito, sinabi niya na published in 2018. Pag ito kinlik mo, it takes you to the journal, basically. So, mas okay na kasi at least meron na siyang mga direct links na binibigay. Research on oils for supportive cancer. So ito, ang napansin ko dito sa study na ito, mas marami na siyang mga binibigay na mga information, mas marami na siyang mga quotations. Sinabi niya na ngayon yung mga potential side effects ng mga essential oils. Tapos meron na siyang mga binibigay na mga very specific instruction. Pero syempre, it's still, ang hindi sinasabi dito is, okay, yung specific instruction na ito is how did they actually test it for, for other people who are using this kind of method, right? So, ang sabi dito, so it will be up to Jirbie and Lourdes and you guys, clinical aromatherapists, to check kung tama ba yung the way they give this instruction. I will not be the best person to judge whether these instructions are correct. Pero I would say na ang mas maganda dito is that this particular blog, it gives a bit more sources of information. It leads you to the specific source of information. It is a bit more balanced because it says here, so generally, it says here, if you can read it, generally oils pose fewer risks when used properly. They're also relatively simple and inexpensive. They are possibly useful for some people with specific conditions, but it also gives you they also remind people that people should continue their standard of care and never replace that care with essential oil. So merong parang balanced way of telling you, okay, what's the good effect, but okay, take care to still follow the standard of care for cancer treatment.
I think yung source niyan si Jirbie, si Madeline. Kiefer, di ba? Kiefer siya, di ba? So,
It says here,
oo,
David.
Itong si Kiefer na they're quoting her. Because
Madeline Kirchhoff.
Kirchhoff ba yun? Okay, she's a different person. Yeah, kasi yung mga sinabi dito na mga, ito Dr. Kiefer naman pala to, iba siya. So, yeah, yung mga sinuggest kasi nila dyan, parang mga more of, ang maganda yung sinabi na to complement the care, hindi siya yung cure. So,
Exactly.
yun yung mas makes it better than the first one.
Kasi diba yun dun sa una, what essential oils might help fight cancer. So medyo, pag hindi ka paying attention, isipin mo lang, this can help fight cancer. But tama yung sinabi ni Lourdes na, ito medyo mas neutral. Parang kasi sinasabi niya, what do you need to know about essential oils? And what do you need to know about a little bit about cancer? Kasi yung isa sinasabi na niya, which essential oils to fight cancer. Fighting cancer means many, many things, right? So ito, medyo mas neutral na ang dating niya, di ba? Mas marami na siyang mga binibigay na sources of information. So yun yung isang way to, check. And then finally, ito, going to the last na tayo, malapit na po tayo. Okay. So it's a document that comes from this organization. So ito medyo, syempre biased ako kasi alam ko na tong organization na to. It's AACR. It's a very specific, it's a US-based organization. It's very, very specific for doing cancer research. So ito, syempre, alam ko na to dahil, so ako, alam ko na pwede akong, that I can trust in a way I can somehow rely on this information. So, Safe Essential Oil Practice in Cancer Centers, ang kanyang document, right? So, it's from 2018. This is the particular person who led writing the document. So, ito, medyo maliit, pero, wait So dito, very scientific na yung approach nila in presenting information. Kasi dito, makikita mo na, okay, eto na, there are the examples of the presentation ng mga chemical constituents. Yan. So very scientific na yung kanilang presentation ng information. Merong mga specific, okay, questions and why is it important? Tapos, meron na silang message about, okay, how to check the quality of the oil, how to apply it properly. At sa akin, ang pinaka-importante dito is that they have a good way of presenting the different studies. At isang pa sinasabi dito, okay, ito important. One size fits all does not apply to essential oils. So, kasi bawat isang tao, when you're dealing with scents, a scent has a different effect and let's say meaning for one person, one age group. And so kaya mahirap din maggawa ng clinical trial kasi it affects something that is very sensory and it's hard to measure. Okay? So the way that they describe this article, it's a bit more scientific. Ayan, they mentioned the different scientific names also. They mentioned the different side effects. And if you look here, makikita mo ngayon yung potential future directions of the use of essential oils. Makikita mo dito yung credentials of the person who wrote it. And where which institution she is based, and you will see here all her sources of information. So makikita mo yung very, I would say na compared dun sa lahat ng mga ibang blogs, ito mas scientific, mas malinaw kung saan niya kinuha yung information niya, mas malinaw kung what is the message that they are trying to say. At ito kasi yung particular group na ito, they're not trying to sell something. They are an organization that is really engaged in cancer research. So it's not like they're selling a drug or a product, but they're trying to educate people about cancer treatments and cancer and supportive treatments for cancer. So finally, ayan. So, eto na tayo. Ito na yung sinasabi natin na this is the final slide that I have. So, siguro with this talk, what is most important is that we all realize na we have a way to gather information and to be able to understand the strength of the evidence that is being presented to us. At the same time, katulad nung nabanggit ni Lourdes kanina na as clinical aromatherapists and as advocates for essential oils, you actually have the opportunity to exercise scientific method in what you are doing. So whenever it doesn't have to be, you don't need to do a very big clinical trial the way we are doing for drug development in order to be called scientific. It's not, hindi po yun. But the scientific method can be done by everyone, can be done every day, and can be done even if whether you are a doctor, a PhD student, or a housewife, or pwede po natin i-apply ang scientific method. So ano po ba ang ibig sabihin kapag may scientific method? May question ka, uy, dry ang aking skin at parati ako nagkakaroon ng rashes. So, may observation ka, you have an observation. The next question is, ano kaya ang pwede kong ilagay? Ano kaya ang pwede kong maging solution para sa aking dry skin? So, bago ka ngayon, so that's your question, what's the potential solution for your dry skin? Bago ka pahid ng kung ano-ano, lalo na sa face, di ba, or something, syempre magbabasa ka muna kung ano yung mga good solutions to your problem. So you need to do a little bit of research for existing information and answers and to your question. So, ibig sabihin, marami na po tayong levels, marami na tayong information na available, you can make use of it. Pero yun nga, pay attention to the source of the information and how you read the different source of information. So kung kunyari, nagkaroon ka na ng based from what you have read, magkakaroon ka ngayon na tinatawag na, uy, siguro ito okay sa akin, ito, hypothesis. So, you will probably perform a simple experiment. Itatry mo ngayon yung potential solution. So, minsan, you will just try it for yourself or minsan katulad si Lourdes, alam ko na whenever she performs blends, she will ask several of friends and several people to try out o ano ang effects sa'yo ng particular blend na ito. Important po is that, important yung paglilista. Kailangan, kung ikaw ay isang clinical aromatherapist and you're creating a blend, kailangan meron kang documentation no ano yung ginawa mo, ano yung prepare mo, tapos how kailangan magkaroon ka ng consistent way to actually let your friends and your family test it. So, tapos meron ka rin consistent way ng documenting or gathering the information. Tapos based from those, malalaman mo naman, uy, ano ba yung naging effect nito? Ano ba yung naging benefit ng particular solution or yung particular oil na ginamit mo. Tapos, most important po is yun, yung analysis, meron kang conclusion. Important na in a group like this, like the clinical aromatherapist, you have to have an opportunity to let the different members share yung outcome ng kanilang naging sort of experiment para magkaroon ng parang let's say sa research yung tinatawag natin na peer review. Parang ibig sabihin you let other people look at your method, you let other people look at the results of your experiment, and you let other people give you a positive or a constructive criticism about, okay, what could be improved. So yun yung tatawag natin na, yun yung importansya ng you documented your experiment and you're able to present it to other people. Kasi kapag ikaw lang ang gumawa ng blend mo at hindi mo share kung ano yung ginawa mo, hindi mo malalaman exactly kung how good it is really based dun sa experience na mga ibang tao have already done it. So you should be open to sharing your experience and your the conclusion of your little experiment. So pag ginawa niyo po natin yon, scientific method na po yun kasi you have a way to document, you have a way to analyze, and you have a way to report your findings. So scientist na din po kayo, scientist na din po tayong lahat. At ito po ay importante, hindi lang po sa aromatherapy oils, pero sa marami pong mga aspeto ng ating buhay. Pero, so ayun po, gusto ko lang pong tanungin kung may mga questions po and may mga bagay po ba na hindi naintindihan. Check ko lang yun.
And girls, maybe you can show your faces. If may question kayo, shoot it directly through audio. Ako, I can see the importance of this today's presentation, especially for those of you who are about to write your case studies, your paper, final paper, diba? I think this is very important. Ako, honestly, I have never used Google Scholar, so I should start using that because I still go to the main Google and sift through, and it's so hard. Meron ko lang Google Scholar, so I will start to use that.
Yeah. Ako din, I also use Google, pero kapag may nakita na akong information na, uy, ito tama ba to? Then I really try to go through, to filter it, you know? Tapos ako, for a while, meron din akong experience na, for a while, I was so into understanding about makeup. Tapos ang na-realize ko, bawat isang YouTube vlogger at bawat isang makeup artist sa YouTube, ay meron silang specific preference na this is the best foundation. Sabi ko, okay. So that's why parang kapag hindi mo, pagka nakinig ka lang sa isa, you will always think, this is the best already. Pero pag nakinig ka sa 10 makeup artist, they will all say, oh, this is the best for me. This is the best. So yun. So that's why it's important to have to know where you will get your information and how you will have that critical thinking.
Ako naman, parang ginagamit ko yung Google Scholar. Kasi nung ginagawa ko yung research paper ko, ang ginamit ko yung PubMed. Tapos sa sobrang specific niya, wala na natira. Parang bawa, kasi di ba, konti lang yung essential oils. Kumbaga, sa sobrang dami na binibenta ng essential oils, hindi naman lahat sa kanila may gumawa ng study. Tapos yung mga nakita ko na meta-analysis, ang conclusion nila is, parang although maraming ginawang study, yung methodology daw, hindi daw ganun ka-robust, it can be still improved, and marami lang study dun sa mga sikat na oils, lavender. Pero kung halimbawa gumagamit ka ng mga kakadistill lang na oil or mga obscure oils, like halimbawa kunzea, mga ganyan, parang bumili ka dahil gusto mo yung amoy, pero hindi mo ngayon alam kung okay ba to o hindi to okay. So, yun. So talagang parang it takes time talaga. So mas na-appreciate ko ngayon yung mga nag-e-effort na mamili talaga ng mga yung parang pinag-isipan. Kasi hindi pala madali mag-research yun. Tsaka thank you dun sa sharing na hopefully sa future, sa loob ng grupo natin, makapag-share tayo ng mga maliliit nating mga experiments. Kasi nakakatakot mag-share eh. Kasi parang feeling, oh my God, paano pag sabihin nila, paano pag mali pala to, di ba? Tapos nagawa mo na lahat or di ba, parang nakaka-hurt ng ego pag medyo mali pala yung ginawa mo. Yun. Pero it's good to know na part siya ng scientific process to learn. It's not meant to put people down. Kasi paano natin mapopromote yung mga bawa Philippine essential oils kung hindi naman natin inaaral or kung inaaral natin, hindi naman natin sinishare. Ganun. So in a way, parang medyo bumaba yung fear factor na baka pag fiestahan ka, parang makancel ka dahil na.
Grabe.
I think it's a great effort na you made this group of that it's actually a group that is encouraging people to have a critical thinking when it comes to essential oils. Kasi ako yun ang perception ko with this particular group. It's really a group that is trying to understand, okay, how essential oils work, what is the scientific basis for this. And it's something na kailangan yung ipagpatuloy kasi I think what I can see is that there's so many other sort of commercial influences when it comes to use of essential oil na hindi lahat they understand what's the correct way of really using, what's the scientific basis behind. So siguro magandang maging exercise nyo yun nga na don't be afraid to share the little experiments.
Si Ems may comment tungkol dyan eh.
Okay.
May sinabi siya sa chat.
Sige. Ayun. Yeah, yung mga case studies, I think it can be a good starting point for you to have parang aromatherapy oil research group.
Oo.
Parang
Pero ano ba yun? Kasi halimbawa, kasi dun sa case study, hindi siya one oil for 5 people. Parang yung nag-doctor's consultation, parang kumuha ka ng. So, pwede pa rin ba yun i-share? Na parang ano ba yung tawag doon, yung sa hospital na parang may case presentation kayo or something na here we have a woman, blah, blah, ganun.
So, ang importante sa case study, ang importante dito, kapag you will present a case study or you're thinking to make a case study, you need to document your process and your observation very, very clearly. So, ano yung ginawa mo? Kasi by itself, a case study will not be a strong level of evidence. Kasi it's one person it's one person observing. How to make it a stronger form of evidence is if you have well documented your process and your results, and then you also look at other case studies that are similar to your to your specific case. So, kunyari, you did let's say lavender oil for, let's say, I don't know, a sleep improvement of sleep for your relative na may sakit. What you can do is then you can compare the kapag na-document mo ng maigi yung iyong experiment at yung result ng iyong case study, you can compare now sa mga similar, slightly similar or more similar case studies na similar yung experiment, you can compare. So yung importante, if you document and then you report, kasi then you allow other people either to learn from you or you are able to learn from other people. Kapag hindi mo sinulat, hindi nangyari yan. In research, when something is not written, it did not happen. So, kailangan meron kang notebook na, okay, at least itong ginawa mo, ito nilista mo. So, of course, ideally, case studies, you will move up to a higher level na, okay, meron ka ng, instead of one person, meron ka ng 5 people that you try to investigate kung ano yung, if it's gonna be the same effect. Pero yun nga, stages, nandun tayo sa stages of investigation. So, it's good to start with a case study, document it well, and then once magkaroon ka ng good result, then wouldn't it be interesting to find out, sa isang tao nag-work, what if sa family, sa buong family mo, but you need to document also how you did the experiment and what were the effects for different people. Kasi kailangan mo ilista, ito effect sa ganitong age group, sa teenager, itong effect, itong patient, yung client B, pregnant siya. So, kailangan mo ilista yun, then you can make a comparison for others. So, yun. Pero it's good to report what you have done and to share to your group what you have done.
And I hope hindi umabot sa level na nahihiya kayo mag-share. Parang walang cancel culture sa APA. Walang ganun. Bawal yun. Sisipain natin yung mga nagka-cancel culture. Bawal ang cancel culture dito.
Kasi pag nag-start ka pa lang, di ba, lalo na dun sa, medyo nakaka-scary kasi mag-make ng case study. Kasi first time ka nagpe-present ng, kumbaga, potential solution dun sa, and then usually kasi sa case study is, you need to do, for one person, 3 rounds to improve the blend hanggang makita mo kung ano yung nag-work kay person. Tapos minsan, tapos magko-comment si tutor mo, whichever school it is, kung what she thinks you did right or wrong in your parang presentation of a case study. But yun na nga, hindi pa kami nagkaroon ng chance within the group to share parang siguro either para bang the best or the worst of the case studies that we made para hindi namin maulit yung mga mali for future students. And we haven't shared our final paper, but except for Jirbie, I think shinare niya na yung ilang-ilang niya, di ba? So, kasi parang feeling mo na sino makikinig sa akin, nagdi-discuss lang ako ng oil, di ba? Pero, yun na nga, parang in a way, it's a good opportunity na ma-practice to speak to a small group of, parang advocates. Hindi pa kami lahat clinical aromatherapist, siguro sa future, maging ganun kami, yung sa mga may plans, yun.
Pero I think it's a good way to to start this, what we call culture of research, culture of, critical thinking, especially for your field. Kasi napakadaling ma-impluwensyahan. There's so much commercialism in it. So if you are a small group and you have a way to try to show that, you're trying to do this, you are helping, you are empowering other people as well to be critical, to have a critical mind, and you probably are helping that other person to avoid the mistakes that already happened before. So hindi don't think na kailangan lahat kayo maging clinical aromatherapist na before you start having this culture of research. You can already start it now, and then as you grow bigger, as you do more research together, you might actually encourage more people to have that certain level of professionalism, certain level of, uh, um, yung parang, yun nga, everybody can be a scientist. Everybody can be a researcher. You don't need to be a doctor to be a to do the scientific method. So, yeah.
I think it's very important now we're having this day kasi I noticed lahat na nag-a-attend right now are all either students na take ng certification or at least level 1 certification. Yun, kakagraduate lang. So, all ears talaga sila and gagamitin nila. But before that, Ate Carmela, I have a question, and this has been boggling my mind since we started the presentation. Since you are a researcher and a doctor, do you ever see essential oils parang being part of your study, part of your research na? I mean, yung mga doctors ba, are they open to using aromatherapy and essential oils as part of their healing modality?
I would say this is something that is very, very important as so from the perspective of cancer research, there are many aspects to cancer treatments. And there are many, many forms of supportive treatments. So, first of all, cancer research at the moment is, nandun na kami sa tinatawag na we call precision medicine area. Ibig sabihin, one drug does not fit all. Okay? One treatment does not fit all. And there is not one type of cancer. And we are also realizing that kasi ngayon we can see that, for example, specifically for breast cancer patients or for certain types of breast cancer, the patients undergo very long treatments, and they also have a very, very long what you call time, yung tinatawag na, we follow them up for a very long period, 10, 15 years, 20 years. So in the field of cancer research, we are also seeing that apart from medicines and apart from traditional drugs, okay, we can see that there are many, many other ways that we need to understand or to study to improve what we call quality of life ng aming mga patients. There are also many studies being done to support cancer patients who are undergoing, let's say, surgery and or chemotherapy. And it's not just a way to support them na yung parang bibigyan mo lang ng additional medicine. Sometimes yung kanilang parang wellness that will help them to go through a very tough treatment becomes equally important. So there's a lot of research that is going on that aspect, yung how can we better support our cancer patients so that they will be able to undergo a lot of their treatments. So bahagi ng mga supportive measures na ito is that yung mga different practices of, let's say, yung mga different types of exercises, different types of diets, different types of essential oils that can calm patients, that can relax them, that can give additional feeling of well-being. So for me personally, I see that there's a huge opportunity for merging yung knowledge about essential oils in order to support a lot of patients who are undergoing cancer treatment. it will probably not, it will of course not replace the treatment itself kasi as you have seen, as I've shown you, yung investigations for cancer treatments, they've undergone so rigorous kinds of research. But yung sinasabi natin na human factor, there are so many dimensions to the well-being of a person. And for us, if a person cannot take a drug, then they cannot get cured. So we have to find all the possible ways to support them to improve their well-being, to enable them to go through the treatment. So marami sa mga effects ng drugs is that they have difficulty of sleeping, difficulty of eating. They have changes in their taste. So if there will be enough good research coming from complementary medicines or essential oils that can help address this, that would be great. You know, a lot of patients who are undergoing cancer treatments, they don't want to take another medicine to help them sleep, let's say, or to help to combat the nausea. But if there is going to be stronger research to support, oh, this kind of essential oil, it will help patients to, you know, relax and to have a better well-being as they undergo their cancer treatment, then that's going to be great. So for me personally, I see it as a very important area of research. But the challenge for your community is that you need to have the good research to support the research that is being done on the field of cancer treatments. So para you can find ways to strengthen your level of research, your level of evidence, so that it is considered as an equal partner or as a complementary partner to the traditional or to the, you know, drugs and to, you know, to these kinds of treatments.
Thank you. Thank you so much for that. Because I understand in Europe, di ba, parang mas open sila to use essential oils as a complementary supportive care. Parang dito sa Philippines, mas may resistance pa. And,
I see.
as I understand, in US naman daw, hindi rin lahat. Hati pa rin daw. Depende raw kung sino yung nag-manage ng hospital. So parang it's different also per country.
Okay. Pero I would challenge you to really strengthen your team, to really strengthen the scientific work that you are doing. And I will challenge you to really share your scientific or your little experiments. I think it's going to make your group stronger.
Thank you. Tama. We shall do that. Anybody else? Sino pa bang may question?
Yes. Okay. Yes, we need to. Ito, nakita ko yung comment ni Jellyvet Gallardo that we should support a culture of research.
Yeah. Okay. Meron pa? Kung wala na, maybe you can turn on your video so we can have our group photo.
Huwag na pong mahiya.
Class picture lang tayo ng slide. Mga 5 seconds lang. Huwag na kayong mahiya. Ayan. Oh, sino pa? Ira, Ems, Jel. Ayan.
Mga kagandahan naman pala ang ating mga participants.
Wala daw
From
si Ems eh.
from Baguio to Guam. Guam ba? Oh, di ba? Oo. Yan, from Brussels si ate. At tayo, nandito. Ay, Nueva Ecija, si Lou. At ako nasa bahay ko. Okay, picture na tayo. 1, 2, tayo, stitch up din. 1, 2, smile. Okay, one more para sure. Hold on.
Miss Universe pose po tayo.
Ay, ganon. 1, 2, 5.
Ayan mga kids.
And then, ayan. All right. So I guess that's all for today. Thank you so much, Ate Carmela, for gracing us with your presence.
Thank you, Doktora. Learned a
Dami
lot
naming
today.
natutulan.
Pwede na-educate.
Oo nga, ang dami na-educate. But I
Maganda
have a
yung
quick
ano.
announcement. Go,
Maganda
Ira,
yung
go.
ano. Ha? Maganda yung ano, yung case study sharing. Kasi like me, yung research ko is about integrative, adding aromatherapy sa integrative care, adding it to the conventional medicine. So the one that struck to my instructor was the case studies, which I had two specific clients. Isa is just post of aneurysm, and then the other one was a heart attack. So I think it was significant for them, the blends that we made and created. And I think the case study sharing is really valuable for our community to grow further into integrating aromatherapy sa, and adding it to the complementary care in the Philippines. Yun lang.
Tsaka okay yan, we will do that. Kasi sa AIA, we are doing na ngayon yung parang journal review. So parang nagpipili sila ng parang previous journal posted sa AIA, within AIA, tapos parang yung pinag-uusapan namin. So maybe for our group, we can do that. Kasi I know like si Ira, meron ka ng mga case studies sa level 1 and your level 2. Si Lou, ako. Even yung mga nagtitake ng certification, if you have, di ba syempre nagsusulat na kayo ngayon ng either ng paper nyo or you are in the process of creating your case studies. Maybe if you can talk about it or kanya may tanong kayo, we can parang pitch in or chime in mga ideas na kung paano nyo pa ma-improve yung case studies nyo. So I think that would be fun. Thank you, Ate Carmela, Dr. Carmela, for all the insights and all the learnings today. Wait, meron ako mga announcements bago lang natin i-end to. So I would like to invite everyone. Actually, I have another aromatherapy group ngayon with other parang ibang group na naman to na on mga foreigners. So I would like to invite everyone, if you can please join, search na lang sa Facebook group nyo, Aromatherapy Safety Group. So itong group naman ito, it's more focused on, as its name, aromatherapy safety. I am one of the admins there. Andun sila Hannah Tisserand, all the big names again in aromatherapy are there. So if you are interested to be part of that, you can. It's very, very new. So parang marami pa silang programs na niluluto. And there are parang like flash sales kasi nandun sila. Basta all of them, Madeleine Kirchhoff, marami from iba-ibang countries, Kayla Fioravanti, yung mga nasa summit nandun din. So you can join that. Another one is I will be joining as part of the educational roundtable panelists sa Botanica 2022 this May. So Botanica 2022 is the aromatherapy conference headed by Rhiannon Lewis. So she's a clinical aromatherapist in France. So every 2 years. And so para siyang NAHA conference pero sa Europe. And I'm invited to take part in sa educators roundtable. You can also check that out. I think meron silang Bloom package. So nasa $100-something lang or euro yata, euro. So you can check that out. So yun lang naman ang announcement. And final announcement, our next APA livecast, I would like to invite you girls to join every first weekend of the month. And for June, si Ira naman yung mag-represent. And actually, nandun siya sa natin, naka-put up na siya dun sa linky.ph/APA Roma, yung link na nasa Instagram. But I will also put up an event on our Facebook group para makasign up na kayo as early as now. Ayun. So yun lang ang tatlong announcements. Again, Ate Carmela, thank you so much ulit. I know you woke up early for us. Lou, thank you so much for recommending Ate Carmela. Last year pa namin pinaplano to ni Lou actually. So I'm just very happy that eto na, nagawa na natin siya.
Salamat din po sa inyo.
Ayan. So, thank you so much and happy
Ingat po.
weekend.
Happy weekend!
Bye! Thank you.